A disgrace. According to the Gleaner article, several angry parents voiced concerns about a breakdown at the Bustamante Hospital for Children in St. Andrew on Sunday. Parents who showed up at the facility complained about the long wait times and staff shortage. But Health Minister Dr. Christopher Tufton says this was expected. This was expected. This was expected.
They can go to their health center to see a doctor or to their private physician to the extent that they can afford it.
A disgrace. A disgrace. The St. Anne's Bay Regional Hospital says it is prepared to treat an influx of persons with dengue-related symptoms. This amid reports of a surge in dengue cases. A disgrace. The Montego Bay Chamber of Commerce says it will be keeping a close watch on the progress of the Cornwall Regional Hospital. Health Minister Dr. Christopher Tufton estimates the renovation will be completed in 30 months, although there have been multiple missed deadlines over the past few years. A disgrace. A disgrace.
There are many who have expressed to us as a chamber their great concern regarding the prolonged delay in the completion of that Type A hospital. The business community and the people of Western Jamaica have long awaited the completion of this vital healthcare facility. Our residents deserve access to world-class medical amenities, and it is our duty as a business advocate group to ensure that this well-needed facility becomes a reality.
My viewers and subscribers, you tell me the truth now. Only not think this a man a one big failure. Only not tired for hear this a man a name call and nothing good him name a call pan. Can you imagine parents come out and demonstrate over Bustamante Hospital a children say, oh, this a broke down, that they broke down, and them have to wait long. And his response was, we expected this. So since you expect it, why you never put none in place to do it? Sir, you's a big failure, you know, and you need to get voted out. See, Cornwall Regional Hospital for done how long and them miss several deadlines. Him a go say they go finish the next 30 months. So the people in my sentence be attacked say dengue and the rise. Only know say this a man a fail. Him don't know nothing about healthcare system. My viewers and subscribers, please like and share the video. Make everybody say this a man a fail. I want to type in the comments and tell me what you think. I want to watch the video to the end. Forget the full story. Watch the video to the end.
Health Minister Dr. Christopher Tufton has responded to fresh concerns about overcrowding at the Bustamante Hospital. The concerns were published in a Gleaner article in the wake of a spike in patients. According to the Gleaner article, several angry parents voiced concerns about a breakdown at the Bustamante Hospital for Children in St. Andrew on Sunday. Parents who showed up at the facility complained about the long wait times and staff shortage. But Health Minister Dr. Christopher Tufton says this was expected.
There is a period now that we're experiencing involving dengue, involving upper respiratory ailments, the flu season, some would refer to it as, which will see more than usual cases, and also COVID, by the way, which will see more than usual cases. It is something we have said repeatedly. The advisors go out weekly to say the same. So persons should expect delays, and to the extent that they can go to their health centers to see a doctor or to their private physician to the extent that they can afford it. But of course, we will not refuse anyone, and there is a triage process that deals with emergency cases.
While acknowledging the issues at the facility, he says the staff shortage is not new.
But what the institution has been able to do, its management and its staff, is to make do with who they have and to share some of that burden with the University Hospital of the West Indies. The same for beds. Whenever we have an overcrowding with beds, there is an overflow arrangement that takes place between Bustamante and the University Hospital, where children up to 12 will be not charged, or their parents won't be charged, once that overflow takes place, is in effect. And so, again, you know, I will not deny a challenge because we've said it. I am not prepared to say it's a crisis.
Dr. Tufton says there have been discussions about the long overdue expansion of the hospital.
I was there last week, Friday, I think it was, or Thursday, one of those days, and we spoke about the plan for expansion and that we will literally double capacity with the Western Children's Hospital, which is coming on stream in the West, which will then ease some of that burden. So something is being done in the medium to longer term.
The St. Anne's Bay Regional Hospital says it is prepared to treat an influx of persons with dengue-related symptoms. This amid reports of a surge in dengue cases. Karen Simpson reports.
Since the Health Ministry declared a dengue outbreak earlier this year, more than 300 persons with dengue-related symptoms have passed through the St. Anne's Bay Regional Hospital in St. Anne. Of that number, at least 37 were admitted to the facility. This includes children and adults.
For now, for St. Anne's Bay, I believe we are doing much better than many of our other counterparts. Our numbers have been low. And I think part of this is due to the work that the primary healthcare division has been carrying out in our communities, as well as the education that we have been doing. We have also increased education on the hospital compounds to patients in the outpatients department. And we have also been educating our staff members so that we can educate the communities that we live and work in.
Chief Executive Officer Dennis Morgan says while the hospital is always in need of more resources, the staff has learned to manage the little they have.
There's some impact, but I would say it is minute to some extent, but it's not where we could say, because of dengue cases, we can't deal with X, Y, B, C, and D. We have been managing well. Again, COVID would have taught us a lot of how to manage these things. And before COVID was Zika and all the other outbreaks, and we have come through those with lessons learned.
Mr. Johnson is urging persons visiting the facility for treatment to exercise patience, as priority will be given to emergency cases.
The worst word to use to an individual is the word wait. So once you ask them to wait, it's like you're using a bad word. And so for some persons, the word wait triggers them off. And once they have to wait within the system to be served or to get an answer for a doctor or nurse to speak with them, then they become disgruntled. Once they feel that their need is not met, then they feel that we're not treating them well. And so what you find out is that the 5% who would have had that experience are the ones who complain, are the ones who post it.
Carrie Simpson, TVJ News.
And Mr. Morgan is appealing to family members not to leave their relatives in the care of the hospital. He says the hospital will continue to work with government agencies to deal with this issue of social cases.
In terms of placing those cases that can't be returned home for one reason or the other, or don't have a home to go to. And so again, a part of our holistic approach. We also plan where we can discharge of some of these social cases, and so again the whole planning process, and we are very keen to ensure that those persons who would have been our potential long-term patients, we are very keen to having them move to locations, whether it's back at home or in other setting, that is suitable for their condition.
The Montego Bay Chamber of Commerce says it will be keeping a close watch on the progress of the Cornwall Regional Hospital. Health Minister Dr. Christopher Tufton estimates the renovation will be completed in 30 months, although there have been multiple missed deadlines over the past few years.
There are many who have expressed to us as a chamber their great concern regarding the prolonged delay in the completion of that Type A hospital. The business community and the people of Western Jamaica have long awaited the completion of this vital healthcare facility. Our residents deserve access to world-class medical amenities, and it is our duty as a business advocate group to ensure that this well-needed facility becomes a reality.
And President of the Montego Bay Chamber of Commerce, Oral Heaven, is calling for specific legislation to help fight crime.
As a united business advocate group, we're collaborating with the chambers of commerce across the island. And we reiterate our call last week through a letter to the Prime Minister to enact the Enhanced Security Measures Act, ESMA, providing our law enforcement with tools needed to combat crime effectively, and at the same time allowing our businesses to operate in a safe and productive environment. Now, the safety and security of our citizens and visitors are paramount to the sustained growth of our local economy. As a business group, of course, we're concerned.
Boy, my viewers and subscribers, nothing good for say. Nothing good. Nothing good at all if it's about this man. But him dip on social media, dance and I do everything. Yeah, my dance and I do everything on social media, but him now fix the health sector. Children's hospital, them short of staff. Him same did expect it, him not do nothing about it. Cornwall Regional supposed to fix, it do fix, people asleep on the ground. Him a claim say him a go put private wing pan the hospital and the hospital not done yet. Say dengue dep on the rise, you know, say how long me I tell them about dengue? Long time me I tell them about dengue now, them now listen, you know, say dengue dep on the rise, how much people lose them life. My viewers and subscribers, you have to hold them accountable, I will have to vote them out. You have to vote out this man here. Him and Andrew, cause Andrew say I'm the best health minister, lie them a tell. Please remember to like, share and subscribe to Jamaica Hot Topic.